Welcome to another episode of my podcast. Today I'm joined by Dr. Rahul Abrol. He has spent over 2 decades in the industry in intensive healthcare. It's great to have you here today, sir.
Thank you, Arul. Thanks for having me here.
Let's start. There's lots of questions we have for you regarding the healthcare and medical space.
Okay.
Can you explain what your role is in the health and life sciences industry? Because it's a very broad industry with lots of different jobs and roles.
In past 30 to 40 years, the medical industry has really changed.
Right.
It has moved away from vanilla medical practice to a large-scale managed healthcare.
Achha. Okay.
Right. Across my career of 25 years, I started with the normal medical practice as a doctor, and then I moved into managed healthcare. So managed healthcare is over the life cycle of patient's treatment, how you optimize the care.
So with the rise of AI, AI is coming and it's going to change a lot of fields. And I feel like healthcare and medical is one field which AI either will have like a lot of change in or very minimal change in. So what do you think? How do you think AI will change the landscape of medical?
So very interestingly, if you look at all the fields, I think the medical field and the healthcare field is the one which is going to be most impacted by AI.
Achha. Okay.
And we are already seeing the changes. Right?
What does that mean? Like, where changes?
So, traditionally, the medical healthcare had 4 pillars. Okay. That was diagnostics, treatment, care, and post-care. Now, all these pillars have been overtaken by AI. So today, we can have a patient with a very complex disease, and you can have his end-to-end treatment using only AI. You don't need a doctor.
Wow.
Right?
Okay, so is this like, AI is helping a doctor, or, like we just Google up our symptoms and, we get a little diagnosis with Google or using ChatGPT, so like that, or like, is AI helping doctors make proper predictions with AI?
It's slightly more complex.
Achha.
Slightly more complex. So definitely predictive analysis is the basics of AI. But what AI does is that it can predict disease. Picture a doctor who tells you before even you go to him that I'm suffering from a disease, that you're going to suffer from this disease.
Achha. Tells you
and then tell you that this is the treatment which you are going to get, and then tell you this is the medicine which you're going to take, and this is what your lifestyle is going to be.
Before you can tell them the
Before
problem.
you go home. So, and I'll give you an example.
Yeah.
What if I tell you that you look at the camera for 15 seconds and then you get 90% of all of those reports which you had with your blood sample?
Without the blood work and everything.
Without the blood. So,
wow.
So there is a technology called photoplethysmography.
Achha, that's a long word.
So, yeah, it's a long word. That's why I said I'll try to make it, to keep this conversation less academic. So what this photoplethysmography does is that with a very sensitive camera, it will look at your face, okay, and it will analyze the small arterioles under your skin.
Achha, okay.
Right?
Okay.
And from that, it can tell you what is your HB level, what is your blood sugar level, what is your KFTs and LFTs.
Wow. Just from the 15-second clip.
I'll give you an example. What AI has done is, currently, even in the market, there are different apps. All you have to do is a small patch on your skin, and it will give you a graphic representation of your blood sugar minute by minute.
Oh, minute by minute.
Right? So you exactly know how much is your blood sugar now. And then it also indicates you that what you're supposed to eat, you're supposed to exercise, or you're supposed to rest, so that your blood sugar is controlled.
Wow.
Right? So you are having a lab technician, a lab, and a doctor 24/7
On your phone with the help of
on
AI.
your phone.
Wow. I thought, with the rise of AI, people will be objecting to medical use of AI because, people don't trust AI. People say, robotics, we don't trust the robots with our health because that's the most important thing in our lives. But with stuff like this, these apps, that's amazing. It builds trust into people and they'll understand that, this is a good thing and we can benefit from this.
Yes, absolutely, you can benefit. And especially, places, economies like India. India is a large country, right? Uh, so, take an example of diagnostics, right? If you go to any tier 3 cities or small villages, you have very few good radiologists. So you can have an X-ray, you can have a CT scan, you can have an MRI, but interpretation of it is very, very difficult because for you need a radiologist, and radiologists are only available up to tier 2 cities. In tier 3 cities, there are very few radiologists. But with AI, even in a small remote village, you get your X-ray done, and AI will give you a better interpretation than any of the best radiologists can give.
Wow.
Now, the question which you had that will people trust it? So I have a real life example. Many years ago, in Safdarjung Hospital, came a patient who was in a very serious condition.
Acha.
Being a weekend, the doctor on duty was a junior doctor,
Okay.
and he could not diagnose it properly. Had that patient come on Monday, we could have saved him because a senior doctor would be there. Right? He's a good doctor, but he does not have the experience of 20 years.
I think with
Right?
AI, that
But
could
what
fix.
AI will do is, you have AI protocols. Okay? The AI will guide you how to treat that patient. So AI can even guide you if you only have a nurse. So 60% healthcare services in our country are run, 60% are run either by underqualified doctors or nurses. But when it comes to diseases, equally complex diseases will be found in those 60% areas also, which are there in tier 1, tier 2 cities. So what do?
You enlist the help of AI to
You have a AI tool which will guide that nurse or the junior doctor how to
diagnose that disease.
diagnose, how to treat, and what to do.
Make a whole treatment plan, like intensive healthcare, the whole thing A to Z.
And this is very practical at ground level, how your medical science is helping in countries like India.
So, AI is helping us in lots of schemes, and with the rise of AI, I think junior doctors can also be benefiting, and senior doctors can also benefit, I think. So, this will elevate healthcare in like an exponential way, right? Another question I had was neuroscience. That's a very delicate field, right? And that's I want to say, still developing field. How would AI change neuroscience and the study of the brain and sensitive areas like the brain?
Neuroscience is a very, very technical and complex stream.
Yeah.
Right? Traditionally, doctors have always struggled to diagnose, treat, and do research developments in neuroscience.
Right.
And one of the reasons for that has been that apart from the complexity, so now I'll talk in the terms of data.
Okay.
The largest of the supercomputers which we have developed may not be able to process the data with the same speed and complexity which our brain can.
Wow. So our brain's basically a supercomputer in our head.
Our brain is a very, very complex machine.
Wow.
Right? Medical sciences is all about prediction. Predictive analytics is the bedrock, is the basics of medical science, rather any field in AI. So the quantum neuro mapping, which is being done, is an absolutely fantastic research. It's mind-boggling.
Okay.
So at a very basic level, if I tell you, a doctor can predict any future neuro episode which may occur,
In
have
addition-
a optimal treatment,
Wow.
right, and create a plan for the patient what he needs to do or not to do.
Wow. So AI is helping us in ways that I couldn't even imagine. I thought, neuroscience is a very delicate field, so AI won't be helping us or trusting, it won't be a trusted source of like guidance. But with quantum mapping, as you say, and predictive analysis using AI, that's just amazing how it can help us.
So I think one of the field which is really, really gonna differentiate AI is neuroscience.
So, to make sense of this, how can a student my age get ahead of the curve in AI and medical use of AI? How can we get ahead of the curve?
So I think the best field which a medical student or a student like you can go is research. Using AI, there's lots of medical research in the areas of diagnostics, in the area of pharmacology, in the area of AI-led treatment.
Okay.
Research is again the backbone of AI. What is AI? It's just like coding.
Yeah. It's
Right.
made on code.
It is based on code, right? But basis that code, the research which you have to do, the outcome of it
Yeah.
is dependent upon how well your research is done. So mixing now the research capabilities and the AI capabilities. Okay? As I said, in the field of diagnostics, in the field of pharma, in field of research. So I would urge that go into the research field in AI.
Well, that can be done, I think. To get into that field, you can do a lot of things, right? It doesn't have to be fully just medical based stuff. No, it can be-
There's few limitations, right? And if I take example of many of the Western countries also, genetics, for example, genetics as a stream is very developed,
Yeah.
right? But the research in this field is just starting. So it's just like you have an engineering degree,
Yeah.
right, from MIT, but you go to a place where they don't need you,
Okay.
right? But in coming times, this is all going to change. But the backbone is research. So anyone who wants to venture in the field of medical AI, research is the field to go.
Wow. Okay. So, from what I can tell, AI is going to help us with research. AI is going to elevate the landscape of just medical overall and just help us in ways I couldn't even imagine at the start of this episode.
And overall, if you look globally, again coming back to the healthcare, we can reduce the overall spend by 20 to 30% by using AI.
Yeah, all right, fair enough. It'll save lives in the process.
Today,
too.
the big healthcare players like US, right? The expenditure is trillions of dollars. The system which there is in US is insurance based. There is lots of fraud, waste, and abuse. Using AI, you can reduce that to 20%. So what you can do is you can have a optimal healthcare which be way better than the healthcare which you're receiving now, okay? But at a reduced cost of maybe 20 to 30%.
Oh, it's just a win-win overall.
It's a win-win overall.
Speaking of good things, let's move this conversation onto a more light-hearted tone.
Sure.
Since you have a plethora of experience, with over 2 decades, almost nearing 3 decades, right? I think more than that, maybe even. Can you tell us some of the funny stories or a funny thing which has happened to you as a doctor, as a medical practitioner?
Oh, there are many. What can I say? So when I got into medical profession, okay, so when you get admission into MBBS, so it's like a chip on your shoulder.
Yeah, it's a thing of pride.
And now the way everything has changed, the education has changed. So earlier we used to have our internship once you have completed your degree, but nowadays from second year, third year you start having that. So when I was in college, we also thought, why not have some internship or some experience after second year?
Sure.
So one of my friend, her father was a very, very influential doctor. And he had his clinic. So one of the days we approached him, I just completed my second year. So we told him that we want to do internship in your clinic. Sure. He said, well, I'll pay you money also.
Oh.
Very happy. Very, very happy. So we said, which department? He said, Department of Ethics.
Okay.
What is Department of Ethics? Whatever. It's going to be internship. So the time and the date was decided. And he said, all you have to do is, on this designated time, come to me, come to my office directly. And that was a huge clinic. Huge clinic. So the way clinics are in Europe. So on the designated day and time, well dressed, he reached his office. He's waiting for us, offered us tea. After that, he called somebody. He said, these are the guys, take them. And he said, it's going to be a very short internship for you, only for 15 days. You have to come every day, an hour in the morning, an hour in the evening. I said, okay. And guess what we did?
What?
We cleaned floors. Mopping floors, segregating waste. Right? And the second day I went to him and I protested. I said, what is this? He said, oh, I told you. Department of Ethics. This is how you learn. Mop the floors, okay, and segregate the waste. And we had to do this for 2 weeks in a row. Morning, evening, we'll mop the floors and segregate the waste. Right?
Well, I think
So
there's
that is the internship.
I think there's a silver lining in this. At least you got paid, right? Well, that was a very funny story. And thank you so much for coming onto the podcast. It has been amazing having you here. And thank you so much for joining in and listening to our podcast.
Thank you. Thank you. Thank you.